Hello, everybody. Good to see everybody. I wanted to thank everybody for coming here today to give you an update on where we stand. We promised any change in the material situation on the ground related to policy and or to the public health, we would give updates. First off, we have 0 confirmed cases in Onondaga County of the COVID-19 virus. We do have 26 tests that were done, and all of them have been negative. We are also fortunate that we have moved from the planning stage and preparation to mitigation practices. So to give you an idea what a mitigation practice is, yesterday we talked about the phone bank that was set up by Upstate for triage cases. We announced earlier on Facebook Live the Upstate University Hospital COVID-19 public triage line. That phone number is 315-464-3979. Again, it's 464-3979. To give you an example of how busy this line has been, it was opened up at noon today. We've already had 80 calls. And that's the way the system's supposed to work. People call, they get their questions answered. If they have concerns, they're talking to medical professionals, and we're not inundating the medical infrastructure. Our triage site will be open on Monday morning, where the community testing will be there, again, for the community, specifically individuals who don't have health insurance and or have any questions, and they're directed there from their primary care provider. Again, for the public, if you are sick with symptoms and you're concerned about getting a test, certainly you contact your doctor first. We will continue to say this, and the reason why we sound like a broken record on this is because some people aren't listening to that process, and it's important that we handle that process. In addition, as we have gone from a planning and preparation phase in both the goals being to really address the potential curve for stress on our medical infrastructure, and also for getting ahead of the curve on cases of positive infections. And that's what you'll see over here again. We've further implemented mitigation techniques. So I'm here to announce first that we are going to declare a state of emergency in Onondaga County. And by declaring that, we will now address the issue that everyone has been asking about related to schools. So and it's important now that we give a little bit of context into the decision-making process for the community that the mayor has to look at, that the deputy mayor looks at, that the superintendent of the city schools looks at, Dr. Desiato from the ESM school district. I know certainly we have other superintendents here. We can't just look at the process and just say, we're going to shut everything down. It's not that simple. There's a process that everybody needs to look at. Our medical experts, our education experts. Many of our children, the only meal they get every day throughout Onondaga County that we can guarantee is they're getting breakfast and they're getting lunch. We can't guarantee that they're getting dinner, okay? And so as the county executive and as the mayor, our responsibility is to our community's most vulnerable. And right now, if we just wanted to say we're just shutting down everything, we're shutting down every school, that we're still responsible for all these young people, okay? So I think we have to put all that into context, and I know everybody's scared, and we have to find a community balance, and that's what we're doing. So certainly other factors when you're looking at shutting down schools, you have to look at virtual learning for the educators, right, in each building. You have to look at child care for working parents. Remind you, it's not okay to have a 6-year-old sitting home by themselves. Certainly, we talked about meals, and right now, one of the biggest impacts that we're looking at in mitigation mode before we have a case of COVID-19 is the impact on our healthcare system. Many of our parents who have children in our school districts throughout the county work at our hospitals. They work at our nursing homes. These are our frontline heroes in the event we need to address the COVID-19 virus. To have them at home without making good plans could be detrimental to the curve over here on our medical infrastructure. In addition to that, we need to be smart and diligent when talking about shutting down schools. Think about it. The first people I have 3 children. The first people I call when one of my kids is sick is mom or dad. Mom or dad, and my dad's birthday is tomorrow, happy birthday, Dad. Mom or dad, at this point, are over 60 years old. And they're the people that this virus will impact the most. So these are all things that go into our consideration when looking at this. So the executive order that we're putting forward in partnership with all of our superintendents who we met with today, and they are fantastic leaders, and I want to thank them all for their partnership, is that I'm announcing that on Friday, March 20th, school will be closed for students. The schools will remain closed until after spring break and will reopen on Tuesday, April 14th. This situation is fluid, and in the event that between now and Friday we get a case of COVID-19, we will move that date from Friday the 20th to Wednesday the 18th. Okay? This will give our administrations in each school district the ability to plan and get us their plans to execute on all the concerns we have put forward today. Furthermore, as of today, all non-essential school activities are canceled, including athletics, field trips, and extracurricular activities. Again, many of you are going to question, why are we waiting for Friday? And I understand that. I understand the anxiety. I've heard the anxiety. But we need to give time to deal with childcare issues. We need to make sure that families are working on these childcare issues and not asking grandma and grandpa. And there needs to be a plan in place to take care of our community's most vulnerable. Again, we will implement this plan faster in the event of a positive COVID-19 case. And in addition to that, we have worked with all of our superintendents to every parent. So any parent who wants to keep their kids home starting Monday can keep their children home with them and not have any repercussions on attendance. Okay? In addition to that, to give you an idea on what else a state of emergency order looks like, we're looking at our ability for flexibility required related to purchasing of activities. Right now, let me give you a silly example. For instance, we have a $200 limit on our credit card to deal with buying medical equipment for triage sites, to buy medical equipment to make sure that people can get testing if we needed to invest in different responses to this. So this additional power gives me the ability to get rid of that. This additional power will allow us to look at the data on the ground as we get data in from Dr. Gupta and her teams to make other informed decisions related to social distancing. I also, before I turn over the microphone to Mayor Walsh, really want to talk to the community about a call to action and really coming together and taking this moment in time to really look out for each other and look out for our neighbors. Look out and figure out ways that you can continue to contribute to this economy. There will be more and more social distancing happening from employers. You'll get more and more guidance as this process goes on, as we enter this next phase of mitigation strategies to prepare ourselves for this virus. But we really need to look out for each other. And again, this is a silly example, but it is creating more anxiety. We've all been seeing the reports about the people racing to the supermarkets and coming out with 2 or 3 grocery carts full of groceries and toilet paper and other things. When you do that, you create anxiety with your neighbors that they won't have these products available to them over the next few weeks. So let's be smart, okay? Let's take care of each other. If in the event of a plan that we've been asking you to have, whether it's a plan for a quarantine, we've been asking you to think about who can help you through a quarantine plan in the event that you're in that situation, not to stock up for a quarantine for the next 8 to 10 weeks right now. Okay, so let's be smart, let's take care of each other, and certainly we believe that the steps we're taking to get today will help give us more time to respond and more time to help our robust infrastructure hold under this potential test of the COVID-19. So saying that, schools will be open Monday, Tuesday, Wednesday, Thursday, and Friday, and they will be shut down at 4 o'clock on Friday, okay? All non-essential school activities are shut down as of today. And certainly in the event of a COVID-19 positive test, which we just got the updated information right before this, we don't have any. In the event that we have one, that Friday deadline will be moved up to Wednesday. Okay? Mayor Walsh?
Great. Thanks to the county executive for his continued leadership and partnership throughout this situation. I want to acknowledge I have my Deputy Mayor Sharon Owens here. As we work with the school district and the families impacted by the school closings, Deputy Mayor will be playing an important role in making sure that everyone is connected to their services. I want to say that I fully support this decision. As has been the case from the beginning, we've made this decision collectively, and this points again to the alignment of leadership that we have in this community. It isn't just limited to the mayor's office and the county executive's office. We have superintendents here. We had all of the superintendents around the table involved in this decision, and again, I think it speaks to the leadership that we have in our community. Again, this gives us time to plan and to prepare. We are lucky to have not had a confirmed case yet, but I think, again, we all agree it's just a matter of time. So we need to use the time that we have effectively. And while for some families it's easy to pivot and to change plans based on what happens with your children's schedules, for many it's not. And I know particularly within the Syracuse City School District, we need to make sure that children are fed. As the county executive said, this is our schools are often the only consistent way in which our children have a meal every day, and we cannot allow that to lapse for even a day as we work our way through this situation. So we're working with the school district, with the county, to ensure that those services are provided going forward. Childcare, again, we cannot be unnecessarily drawing from our healthcare capacity in the form of parents who work in our healthcare systems, bringing them to our home to take care of our children, which of course are critically important. But when we look at who is most vulnerable, we don't want to put ourselves in a situation where we're taking people away from helping those that are most vulnerable through this situation. We also don't want to put people that are most vulnerable in this position by having them supplement the child care. And I think many of us have our own examples of where that would be the case through grandparents assisting with child care. So again, if we can get to Friday, that gives us all time to plan, to answer all of these questions, and to make sure we do it right. And as we've done from day one, make these decisions based on the best data that we have available, based on the expertise and the guidance of those that know most about what we're dealing with. I just want to reiterate the county executive's call to action. We all need to take care of each other here, especially those of us that have the privilege of being among the less vulnerable. We need to make sure that we are protecting those that are the most vulnerable. And there are people through these different actions that are going to find that they have time on their hands. We want people that are willing and able to lend a hand, whether it's through healthcare support services, whether it's through child care. We need everybody in this community who is willing and able to step up and to help take care of each other. Again, I want to thank all of the leaders here, and we look forward to keeping you posted as we go forward.
Thank you, Mayor. And again, I'm going to let Dr. Desiato from the Superintendent of East Syracuse Manoa come up here also to give reflection, but to clarify the 3 steps for schools. As of today, all non-essential school activities canceled. As of Monday, if the parents are in a position where they don't want to send their children to school, they don't have to. And the superintendents have all agreed that won't be held against the student's attendance record. As of the school opening, school will be opened until Friday of next week. In the event of a positive COVID test between now and then, that date gets moved up to Wednesday. Okay? At this time, Dr. Desiato to give a perspective from some of our school district superintendents. Thank you, Doctor.
Thank you. I too want to thank the county executive. These are really very, very challenging times, uncharted territory, and his leadership is vital to the direction that we're heading. I also want to thank Dr. Gupta and our health department, because they have been at continuous access to all of us as superintendents during this time period. First and foremost, this message impacts those who are families, parents, students, our children, our grandparents, and every family will have a different perspective on how to handle this time period. We understand that. There will be some who believe that it is most important to keep your child home. We respect and understand that. It will not count in the sense that we will regard it as a legal reason for absence. So there are illegal reasons, there are legal reasons. This will be a legal reason for absence. In the meantime, for those who are sending their children to school during these 5 days, our educators are a key. We are thankful for our teachers, our bus drivers, our support staff, our clerical staff, all our custodial staff who have been cleaning our buildings morning, noon, and night. We will make ready, as teachers, as administrators, as support staff, all that we need to in order to transition to the capabilities of distance, remote, and online learning. We will help our children to understand what that will mean while they're at home during those particular weeks that we are not in school. We will look to our educators to help us with those solutions. And while we're looking to our educators, we also understand that our educators and those who are in the business of education also have families. We will work with our educators and the needs that they have as well in being able to consider how to balance this period of time with family and with work responsibilities. This is a very challenging time, but as a community, we will make it through this time because we do have the ability to do so. As you have ideas, suggestions, and questions, please approach those who are the most immediate to you in your school, be it your teacher, your principal. We will be advising them starting tomorrow and through Monday, Tuesday, Wednesday of this week and beyond as to all the different questions that need to be answered. Will they know the answers to those tonight? No. But by Monday, Tuesday, Wednesday, and as we progress through the week, we will. And please, I heard the county executive say, if we need to make any mid-course corrections or decisions, we will do so. And it will always be in the best interest of the safety, the health, and the well-being, and the consideration of all during this time period. Thank you.
Thank you, Doctor. Questions?
This decision made, because you were here at about 5 o'clock last night, and you said, and I think as you were walking out, I anticipate there will be a school on Monday, and there will be school on Monday, Tuesday, Wednesday, Thursday, Friday, but what was the decision process as to, at close of school Friday, we are done until April 14th?
Yeah, I think first off, we got everybody in a room and had a discussion. And it's balance. We're balancing the anxiety in the community with the data that is driving decisions. And Dr. Gupta and her team, again, Jeff, every morning we get together and Dr. Gupta's sitting down with Ann Rooney and myself and Dan Weirs, and we're getting information from our hospitals, and we're looking at data, and we're looking at where are respiratory diseases as far as cases going. And again, we've talked about them. They should be going this way, right? Flu season's coming to an end. Right now, they're still here. So when we're implementing social distancing policies, we're trying to do that, obviously, for COVID-19, but we're also trying to do that for the respiratory flu and other strains of respiratory disease overall, because if you have one of those viruses, you're going to get tested for COVID-19, which puts stress on our infrastructure. So we got together. We've had plans and conceptual plans in place for what this would look like. Schools were obviously the next mitigation step. We understand that pressure comes on school districts and superintendents as one county does this and one county does that. Look, every county is different. For the public right now, we don't have a case of COVID-19 within a 60-mile radius of Onondaga County. There's a case in Monroe County to the west, there's a case in Tompkins County to the south, and there's a case in Herkimer County to the east. That doesn't mean we won't have one. And so we're being proactive. Spring breaks in a couple weeks. This gives time by implementing this in a strategic way to give time similar to what was done with the universities. But at the same time, we can't make a decision here based off anxiety and then cripple the medical infrastructure in this community that we need to be strong for when we get that first case to prevent a community spread. So it's a balance. We met with, the mayor and I met this morning with the superintendent in the city, then all of our great superintendents in the suburban districts. We all got together with the city superintendent as well. We talked about different impacts, and each district has their own little needs, but we can't have this crazy domino effect. So we came out with this order, and this gives flexibility to the parents for legal tardies, right? And maybe when I was a kid, I had some illegal ones, right? But for legal absences, in the event that the anxiety level for those households is I don't want my kid in school. Okay, we appreciate that. There's other parents that don't have that luxury, and we have to consider that for all of these families.
You're talking about online learning. What about parents that don't have access to computers? How are you going to deal with that?
I can't speak for all 23 of our districts, but what I will tell you is that for many or for most, we're doing one of two things. Many of us have a Google education environment, so we have Chromebooks or other devices. Those devices are able to be signed out just like a library book, so if students need those, they'll be able to take those home. In other cases, we may be preparing materials that may be sent home in packets, and then, again, we have to work out then a system by which we would be renewing that. In addition, we will be working out the systems by which those students who are eligible for our free and reduced lunches and breakfasts will be able to receive those at very designated locations or through some type of a delivery system. All of that will be worked out over the next several days so that families know what they have access to. So as of March 23rd, it is our hope that we're able to meet the criteria for the state education department that says you are in attendance, but you're in attendance remotely.
And I know it's premature because you said you're still working out the details, but what's going to happen to the students during those 5 days? Are they just going to be at home, or are they going to have the packets?
These 5 days, or
The ones that are upcoming, when starting Friday, you're saying that the students are encouraged to stay at home.
After March 20th is what you're talking about.
Yeah. So what
these 5 days, we would hope that students would be attending school if their families decide for them to attend schools, and we'll be making ready the preparation for some type of online, remote, or distance learning from March 23 through April 13.
Okay. I have a question for what about this the shortages of testing? I know this is kind of a good question. It's circulating a lot, but allegedly there's a shortage, and the test kits, is that still an issue?
So okay, and again, I'm glad. Good question, because it gives me the opportunity to clarify this. The test that is given on an individual, and you can't just get a test. Okay, you get a test if you're sick and your doctor says you need a test. Okay, is a swab. So it's a nasal swab, or think of if you've ever had strep throat, you have a swab. That is then goes and then is tested in a test kit at a laboratory. Okay, so there's two things. The challenge with test kits before was that there's only so many laboratories that were certified to analyze the results of those tests. And so over the last few weeks, we've seen more and more private sector companies come on. We've seen more and more laboratories come on and get those approvals. So now the ability to get the results faster and take in more tests is more robust. But this is what's important, though. In Onondaga County, there was not a person that wanted a test because they were sick, that their doctor, well, let me rephrase that. There was not an individual that a doctor thought merited a test that did not get tested, okay? The test kits are the analysis behind a swab test that happened. And in addition to that, part of our mitigation strategy, Monday morning, we will have a triage site available for testing for folks. You call that line. If they think that you have a test, that you merit having a test taken, then you come, they'll give you a test, then they will then work with their private sector partner, and we'll get those results back. But I think there's been a lot of reporting, a lot of robust reporting on this, and then people hear different things, and they see different things on the internet. The reality is every person who's needed a test has gotten a test in Onondaga County.
Donna, what advice would you have? And I know there are a lot of unknowns, but what advice and
First and foremost, and we can certainly put this up on the various sites if we have it on our site, I would advise that parents read the National Association of School Psychologists site and the National Association of School Nurses on how to talk to your children about this. Because I think first and foremost, children have to have a context. What's happening, why is it happening, and what are we doing about it? Because there will be differences in the days as we go forward, and children are very intuitive, they're very bright, they understand the adult behaviors they see around them, and they're puzzled by it. So we need to assure children that we really are making a plan that what we call school is going to be different. We're going to have a continuous, hopefully, strand of learning, but that learning may take place in different places. The next, I would say, is to engage with their individual school district. I can assure you, and my counterparts, all of the superintendents are preparing for messages that will go out later this afternoon, as well as tomorrow. We're preparing for the fact that as we do have information, it will be sent via what we consider to be our whatever messenger systems we have, school messenger or something of that nature. We will rely on the media to help us with that, certainly, on getting those messages out there. And to be able to realize that while we might not have all the answers right now, what's most important is that we plan for meeting the needs of the diversity of our various systems. The final part is that children are at all different stages and ages in this. So we're going to need to work with families depending on the age of their sons or daughters. For many who are getting ready to graduate, we want them to know we plan to make it through to graduation. That's a very important part of this puzzle. So we do need to be able to plan for all of this. And I do think that our students can also help us. They will have some great ideas for how we can work through this. The main message for parents is, we understand you have to make a decision. You are your child's first teacher. You are your child's absolute advocate in every day of their life, and therefore the decisions you make right now will be respected by the educational community, the governmental communities, and the medical communities based on the fact that you have to make the right decisions for your individual children.
And the expectation is that there's some kind of virtual learning from kindergarten all the way through 12th grade. So it's not just for high schoolers, it's for everybody.
I'd go as far as to say there will be some kind of education for 4-year-olds all the way through to high school.
Superintendent, one more question.
Yes.
When was the first time, is this the first time, teachers and essential staff are hearing of these closures, or have they kind of had some, are you having had some side conversations about that?
School superintendents, we've been communicating since on or about the early February that this, the coronavirus was something that we needed to be paying attention to. More intensely in the last week or so, we have been intensely following the patterns that have been happening across the country, around the world, and certainly in our neighboring counties. We have been preparing for the fact that our staff would need to prepare for the fact that we may need to go to a remote or distance learning. We have many outstanding educators who have great ideas about this. We need to convene those educators and then bring to fruition those ideas. But quite honestly, this is all uncharted territory. It's the 21st century, but for the most part, we've delivered education in, by and large, the way we all understood, which was to attend a school building and go into various classrooms. Now we're going to be challenged to actually deliver it in other ways beyond the classroom.
I guess maybe I should rephrase that. So is this the first time teachers at your particular school have heard about this, or?
This decision?
Yeah.
This is the first time, I heard about this decision just a few hours ago, and so this is the first time any of us are hearing this. And we understand it's a very rapidly evolving situation. I think for the most part, our educators understand it's very rapidly and evolving, and it's not something that's going to end tomorrow. It's not something that's going to be over with on April 14th, but by that point in time, we will have more information, more data in order to be able to make better decisions.
I didn't answer this right now because you're saying you're still developing information, but social distancing, right, is important. How long are we going to be in social distancing? And once we stop the
That's
social
a
distancing,
Dr. Gupta question.
Yeah. Look at so the part of this executive order. It gives us those powers. The governor put forward certain social distancing policies for the state. Certainly, we now have the ability to massage that if we deem it necessary. So we're not going to put forward different social distancing limitations at this point. We don't have a case. This is a process, okay? If you remember the process we've been through, it's changing every day. It's evolving every day. And last week, I think it was last week, technically this week, people were very concerned about having a parade. And then, and many people were concerned about having a parade that even weren't going to go to the parade. But then what changed from there? The national guidance on mass gatherings changed that night. And so then when we look at that, we look at the data, we look at respiratory illness in our county, we look at where at that time we didn't have any cases of COVID-19 north of the Hudson. We get a case in Monroe County. We had some information at that time that maybe that person was on a bus. Right? Now we know, and this is happening. So we make a decision. Mass gatherings at this point don't make sense anymore. So and later on, the governor comes out with more guidance saying 500 people or less. Okay? So this is all evolving. We're going to make local social distancing decisions based off of data that works for this community when we have more information on the threat in real time.
Mayor, this is maybe one question. This is certainly not exclusive to the city school district, but how do we handle those breakfasts and lunch type things that we provide so many of the children? Again, I know it's not exclusive to just your district, pretty much every single district here, but you have a lot of those.
Yeah, I think as Dr. Desiato said, we're still working through those issues, and that's the benefit of having this week, hopefully, to plan for those. We do anticipate some sort of delivery system, whether it's through different distribution centers or direct delivery to homes. I know Superintendent LSA is looking at his kitchen capacity and hopefully being able to continue that through the school closure. But that's the whole point of taking this time, because we have the benefit of time to make sure we do it right. So to be determined.
Any other questions? No. Thank you, everybody.
Thanks.